you so much for trying to help. So I have a question regarding my 2-month-old. She had some potential colic or GERD and was prescribed a reflux med. And then shortly after that, we started noticing some blood in her stool. So her pediatrician recommended that I go dairy free since she's exclusively breastfed. Just wondering kind of when we should start seeing improvements. As I've done a little bit more research, I've seen that sometimes you need to eliminate other things like soy. We just haven't gotten a lot of guidance from her pediatrician. So curious what I should be looking for, when I should be seeing improvements, and what other changes I might need to make. Thank you so much.
Okay, so fussiness in infants is really common, and it's kind of a big topic, but I think the big picture, there's a couple of different things that we always focus on in our practice when it comes to these fussy babies. First and foremost, there's a couple of different priorities that are important to keep in mind. One is supporting breastfeeding and breast milk exposure because of all the benefits of breast milk. The other is maternal mental health, which plays a role both in nursing, pumping, and also dietary elimination. Like, we shouldn't consider that having to take foods that we enjoy and foods that nourish us and give us energy for the day and nutrients and vitamins and all those sorts of things, that those are inconsequential and we should just tear everything out of the diet to try and figure this out. And so we also want to make sure that we're avoiding unnecessary interventions. When I'm thinking about interventions, there's dietary eliminations, there's medications, and the big one that this mom had mentioned in her message was reflux medicines. We always try, when we have a fussy baby that comes in, it's very unusual that the very first visit that we see them for, whether they're our patient, whether we're doing a one-time consult for a second opinion around fussiness, um, it's very unusual that the first thing that we'll do is start them on a reflux medication. First and foremost, there's not a lot of good data that it actually makes a difference for most babies. And so we try to avoid things that haven't been shown in robust clinical trials to make a big difference. And secondly, it seems like, okay, it's just a little bit of acid suppression, no big deal. There's actually long term consequences that have been shown across research studies for over a decade now, showing that there are potential harms from reflux medicines. You suppress the acid in the stomach, and there's increased risk of food allergies, eczema, atopy, asthma because of the way that the gut and the immune system are so closely tied together. There's also concerns about altering the gut microbiome that we're just learning more and more about over the past decade, how the microbiome affects both the gut but also the brain and development and all of those things. The largest reservoir of serotonin, which makes up our plays a huge role in both our mental health and our wellness, both acutely, like right now, but as we grow, those pathways are being built, and so we want to avoid altering the gut microbiome when we don't need to. And we know that suppressing the acid in the stomach does affect the bacteria that grow and thrive and can affect the microbiome. So in the big picture, what we want to do is support breastfeeding, avoid unnecessary interventions, and support maternal mental health. In our practice, the way that we typically do that is first and foremost, instead of looking and spending a lot of time in the weeds of the stool, people text us a lot in our practice, so we do get a lot of poop pictures. And I always tell people, like, you don't realize when you have a baby how many pictures of poop you're going to have on your phone that you're texting with your partner or sending. Like, we get a ton of poop pictures sent to us, like, is this normal, or those sorts of things. My last thing that I'm going to focus on when it comes to your baby and their fussiness is what their poop looks like. And instead, I'm going to look at, are they growing okay, are they comfortable, or are they fussy all the time? If they're growing well and they are not colicky, fussy, uncomfortable, clearly in pain all the time, it's very unlikely that I'm going to do anything but watch and wait and see how things go over the coming weeks. Parents see blood in the stool and they feel like it's an emergency that we got to get to the bottom of right away, but a lot of different things can cause a little bit of blood and stool. So we look for patterns rather than jump on, we got to cut this and this and this out of the diet, and we got to start you on a reflux medication. Maybe early in my career, I was really quick to jump on those things, but having seen thousands of babies over the past over a decade in practice, I can tell you that most of the time when parents text us a picture of some like red in the poop, it's gone within a day or two, no matter what we do. And those that it persists, we look at other things that we can do to get to a better place when it comes to a little bit of blood and poop, and then contrasting that with the level of discomfort and the growth. And so, what we would typically do in a case like this would be start with a short trial of eliminating something from the diet before jumping on reflux medicine because of all the things that I talked about in terms of the risks of that. We would say, okay, your baby is persistently fussy, they're gassy, they have a little bit of blood in their stool, they're really uncomfortable. What we're going to do is eliminate maternal dairy exposure first. Now, sometimes we have to do soy, sometimes we have to do other things too, but if we eliminate everything, then we have no idea what we can reintroduce and get back into the diet. And it is important that moms are able to eat a variety of foods and stay nutritionally in a good place, both for their physical health and for their mental health. So we're going to do a short trial of dairy elimination first and then watch and see. And we'll check in a few days. We typically just text in our practice, but we'll check in a few days to say, did this make a difference or do we need to do something else? Now, if that doesn't make a difference, then sometimes the next step would be to eliminate soy as well and see if that's the culprit. We do short trials and then we reintroduce frequently rather than, yeah, you're going to have to go dairy free and soy free for 3 months or 6 months or 12 months while you're nursing. You're just going to be off of it because we know that we want ongoing antigen exposure for baby to protect against food allergies as they grow, and eliminating things from maternal diet increases the risk of food allergies for babies. So we want to do just what's necessary and nothing more, and not for a longer period of time than we need to. Now, there's other things that you can do to help when it comes to a fussy, colicky baby outside of diet and medicines and all those sorts of things. If they're persistently gassy, this wasn't a thing when I first started in practice, but I heard about it, and then I was at a pediatrics conference, and they had them. The Windy actually is quite the lifesaver. It's basically a tube that you stick up baby's butt that lets gas out. So some babies have just a lot of distal gas. They're not really spitty, they're not colicky all the time, but they're fussy until they can get that gas out. And so the Windy or a rectal thermometer or bicycling their legs, something to help get the gas out can actually make a big difference in terms of discomfort, and it avoids the maternal dietary changes. It avoids the reflux medications or all those sorts of things. So it's really a nuanced question, and I talked for way longer than I was thinking about this. But I think the big picture, to just circle back to putting it all together, is encourage and support breastfeeding, encourage and support mental health, and avoid unnecessary interventions by frequently checking and adjusting what we do, rather than you got to do this for 3 months, you got to do this for 6 months, anything along those lines. So hopefully that makes sense and answers that very common issue that we face with those fussy babies and unsure what's going to help them. The last thing that I'll say is what we see is these babies outgrow it. And so a lot of times, rather than we got to make all these changes, we got to get them off this sort of thing or put them on formula or something along those lines, what we need to do is look at the big picture and give some expectant and anticipatory guidance along. Your baby is really fussy right now. It's really hard right now. I promise you that it's going to get better. And if we can give them that peace of mind and check in on a regular basis, it makes everything go more smoothly and with more peace and less worry.